Thanks for joining us on the Ohio Channel's Facebook Live feed or tuning in on public radio and public television stations. Many of those TV stations usually broadcasting children's programs at this time. And so we are glad that kids, parents, and caregivers are part of our audience because there's lots of information every day coming on what's happening with the state's response to coronavirus and what everyone can do to keep us all healthy and safe and at home, where we are supposed to be till at least April 6th. So let me welcome my colleague Andy Chow here. You have the latest numbers from the Ohio Department of Health that come out at 2 o'clock every day. What are you seeing?
That's right. We're reading this off just updated on their website. There are now 867 confirmed cases of COVID-19 in Ohio. That's 867 confirmed cases of coronavirus in Ohio, reported by the Ohio Department of Health. Of those cases, 91 people are in the ICU. And 223 people are being hospitalized. So again, another sharp increase in the numbers here. And the caveat always being that there are 867 confirmed cases, but the state is very candid in saying that it does not have enough tests. So there could be many more people who do not fall in the high risk category who have not been tested for COVID-19. However, they may still have coronavirus and they're writing it out at home. So that number, as Dr. Amy Acton would say, is just the tip of the iceberg of the coronavirus issue here in Ohio.
And it's a 23% increase from yesterday's number of 704. Yesterday was more than half the state, 55 counties. 10 deaths yesterday, today 15 deaths. It's a 50% increase. So these numbers are starting to come in. But Dr. Acton had said at one point that the numbers would almost be meaningless because they would be coming in so rapidly. The numbers would be going up so much higher. But certainly this 15 deaths is very serious. And the number of hospitalizations, especially in intensive care, very serious.
And what we've seen from state officials now that the big orders have been handed down, now that the big social distancing orders have been handed down, state officials, meaning Governor Mike DeWine and the Ohio Department of Health, have been focusing more of their attention on the coronavirus issue itself when it comes to, again, delaying the spread of the virus to be able to stay within hospital capacity and then trying to build up hospital capacity. So while we don't know exactly how many cases there are in Ohio and that is an issue, what the number is that they're going to be looking at more often is the number of hospitalizations, because those are cases where, whether they've been tested or not, they are now in the hospital. So 91 people in the ICU around Ohio and 223 people in Ohio's hospitals. That's a big number and it's expected to rise. And I think going forward, day after day, it's going to be how can Ohio expand their capacity? How can they increase their capacity? We hear plans of maybe using dorm rooms, maybe getting a motel or a hotel around the state to try to increase the number of beds and try to increase the number of resources and materials that they need to be able to treat the people who are most high at risk to this virus.
And not only when you talk about increasing capacity, are you talking about increasing beds? Because Acton said yesterday the goal was to increase capacity 50 to 100%, not just in beds, but also in personnel. And so they're trying to find retired workers, other people they can pull in. There was a provision in the bill that passed yesterday. The House and Senate unanimously passed a bill that would allow for certain nursing students who have graduated to get licenses before they take their state exams. So there are some efforts to try to help shore up the number of healthcare workers because, again, the number of healthcare workers who are being impacted by this, according to yesterday's number, 16% of the overall total are healthcare workers. And so there's a real concern about losing those folks, especially as we keep going up this surge.
Yeah, and we have this push-pull and this balance going on of trying to find enough PPE. That's personal protective equipment. We expect to hear the governor and Dr. Amy Acton talk more about personal protective equipment. These are masks and gowns and ways to keep healthcare workers safe as they treat people who are suffering from coronavirus. Now, if the state is not able to get more of that PPE, then it just puts more healthcare workers at risk.
And one of the other things that was mentioned yesterday, a lot more data is coming out now. The Ohio Department of Health, one thing to look for in this news conference is the slides that Acton will show that kind of breaks down a little bit more. We're starting to get more data now. We're starting to understand a little bit more about who is testing positive, what is involved in that. And one of the things that she was saying was 70% of people who are going to test positive are going to be over 40. That leaves 30% who are under 40. And there's been, I think, this attitude that it's a disease that really hits people who are older, and we'll be finding out more about that. I'm understanding that Governor Mike DeWine is on his way in the room very shortly. We'll be listening to him and Lieutenant Governor John Husted, Dr. Amy Acton, talking about what's going to happen with coronavirus in Ohio. So far, we don't expect any major orders, though, Andy, did ask a question yesterday about evictions, and the governor suggested that that might be something that he is considering.
Afternoon, everybody. In honor of what should have been opening day, brought my two hats, and when I got up this morning and saw the weather, I thought, this would have been a great opening day. Reds were opening against the Cardinals. Indians were supposed to open against the Tigers. But I did bring the hats and got my Reds tie on, and we'll wear an Indians tie tomorrow. We do have a little video supplied by the Indians and the Reds for us. A video in honor of what's to come as we all get through this, and a reminder of how important it is for us to do everything we can to reduce the casualties, to reduce the number of people who end up with this. And again, we hope to see baseball again in a few months. I'm going to talk about a couple things where I've been asked questions, starting with evictions, and this was dealt with a little bit in regard to the bill that we will sign tomorrow that was passed by the General Assembly. And let me just kind of walk everybody through this and where we are. First of all, the Health Department order, Dr. Atkins' order, we want everybody to stay home. And obviously people have to have a home to stay in. Our courts remain open, only doing the essential things, but I talked to the Chief Justice a few minutes ago, and she reminded me the courts are open, and they're open basically across the country, trying to eliminate congestion, people being close together, but the courts do continue to function. The bill that was passed by the legislature that I intend to sign tomorrow, in Section 22A10, it provides that all civil, criminal, and administrative time limits, all time limits are tolled from March 9th to July 30th. And so what this means is that the courts have more flexibility in all cases. So let's take the question of evictions. An action to evict someone can certainly still be filed, but the courts are relieved of their statutory duty to hear that case within a certain period of time. So again, this will come within the discretion of the court, but the legislature in this bill has relieved them of the obligation to move forward on those particular matters. The court could stay the action. In other words, just not act upon that for a period of time. It's important that the courts have the flexibility and that they not be told exactly what to do, because you may have someone that's a domestic violence case order, or someone's ordered to move out of a home. You would not want that stayed. The same would be true for someone who's committed an illegal activity, someone who's doing something, dealing drugs or something. In those rare cases or those unique cases, we certainly want the courts to have the ability to take the appropriate action. The Chief Justice, Maureen O'Connor, told me that she will be issuing, after I sign the bill, she then will be issuing instructions to the courts. And so I hope that kind of clarifies where we are in regard to evictions. And in a moment, I'll be happy if anyone the news media wants to ask any questions about that, be happy to try to answer those questions. I've been asked to say something about weddings and funerals. These are certainly not prohibited under the order. What we ask is that we not have large gatherings. And I know what many families are doing, let's say in regard to the weddings, in some cases the funerals. They're postponing the big ceremony. People are going ahead and getting married, but the big party, they're going to postpone that until after this is over. Again, something to look forward to as we try to get through this and work through this every single day. Let me talk a moment about kind of what we're doing in regard, as we continue to do in regard to the physical distancing. And again, maybe make a little reference to opening day today in Cincinnati. It's a big celebration in Cincinnati, celebration, of course, in Cleveland. But in Cincinnati, they pretty much historically close everything down, and everybody either goes to the game or parties, and there's always a big parade. And I think it was very good that the mayor, the officials made a decision early on to cancel the parade, even before the season was pushed back. Again, a little historical analogy or historical reference. 102 years ago, this was one of the things that unfortunately Philadelphia did. They had the parade. As I recall, I think it was the St. Patrick's Day parade, but they had the parade. It may have been a parade to sell bonds. It was one of the two. And they had that parade anyway. And that is, historians look back at that and say that was one of the reasons that really kicked up the virus, and more people were getting that, and it was being spread. I want to talk about the other side of this. There's really, as we've talked about before, there's really two sides, and each one relates to the other. And so the social distancing is buying us time. And I've been working in a number of our teams and with hospitals across the state, and we continue to work with them. I was on a phone call today that we originated with over 100 CEOs of hospitals across the state of Ohio. And what we want to make sure is that no matter where you are when you get sick, what part of Ohio you are, that there's a mechanism in place, that there's an orderly process about where you will go, and then if you continue to get worse, where you will go from there. And so we're trying to tie all that together. We got great cooperation from our hospitals. They're doing a phenomenal job, both the bigger hospitals and the smaller hospitals, and we're trying to tie that all together. We're working on expanding capacity. We do not know exactly at this point what the capacity will have to be, but we know that it's going to have to be a lot bigger. I was talking to the governor of Maryland the other day. They're almost going to double their capacity. I suspect that we will be fairly close to that, and that's what we'll end up having to do. So it's a big expansion of the number of beds, big expansion of getting the infrastructure ready to go. But what you're doing every day out there in the social distancing and doing the things that you need to do to slow this spread down buys the hospitals, buys everybody more time so that we can make sure we're up and ready to go when this hits. Very important. Let me talk about one more thing. So many of you have contacted us, contacted your member of the General Assembly, your congressman, and offered to help in any number of ways. Some people have some of the things that we need. And so what we're doing, what we have created now, is a way for you to go up online and get that in very quickly. And that will be a much easier way for us to process that and take advantage of your generosity and take advantage of what you're you want to donate. You can go now to together@governor.ohio.gov. Again, that is together@governor.ohio.gov. Dr. Acton.
Thank you. Well, good afternoon, everyone. It's good to see you again. I don't know about you, but this time of day, being together with the governor and lieutenant governor have been sort of the anchor for me these days. It's a flurry of busyness before. Spent the morning at the Emergency Operating Center, and we'll continue back there afterwards. And we go way into the evening, but somehow we always end up back here together. So it's good to see you. I'm going to go ahead and start with some of our data and announcements. First of all, I want to share with you today that we have created a new dashboard and a new website facing a feature that is very interactive. I want to thank again, I've been calling them the Force, but they are these amazing data analysts and predictive analysts who are working to bring you the kind of data that the governor has promised, and in trying to be as transparent as possible. So you'll find our new dashboard will be interactive. You'll be able to see more about county level age, demographics. And we've also changed how we are showing our cases for the disease detectives and people who are following this. We're doing the symptom onset date, so the actual date when people had symptoms. It gives us a little better understanding of when the disease was first with us, remember, all the way back in February, now from the onset of symptoms as the cases come. So it's not just the cases, remember, but asking people when they really first were experiencing the symptoms of coronavirus and COVID-19. So today we are announcing that we do have 867 people who have tested positive. Still, again, it's a lag time. We have lots of labs out in private labs. We know with our lack of testing, we're not seeing all the cases that are out there that we're presuming, especially people in the outpatient setting, we're presuming to be positive and asking to stay home because we can't test as much. We're testing the higher risk folks in hospitals. And then our total hospitalizations, you see at 223. We know that we have 60 counties. In Ohio, we have 88 counties. We now have spread to at least 60 documented counties. Unfortunately, we are now reporting 15 deaths in Ohio. We also know that we are staying around the area of 11% of our cases are ending up in the ICU. Also on our website, we have information about the age range of folks ending up in the ICU is from 23 years of age to 92 years of age. And next slide, please. So again, that's a little bit of our data. We're updating as best we can the amount of testing we've done, over 17,000. And again, we're highlighting our healthcare workers. We are looking at 17% of those testing positive are in healthcare workers, and we really are trying to track the impact on our healthcare capacity, as the governor said, on folks that are on the front line, not just our nurses and our docs, but folks in nursing homes, our EMS, our firefighters, and our police. And also I want to say our local health departments, we have 113 local health departments in Ohio, and we can share with you today that one in the Toledo area, and they'll be sharing more with you through the media, actually had 2 cases, and much of their health department is now in either isolation or quarantine. This is something we're planning for. It's something that my team and I are planning for. You have to think a lot about redundancy and backup. We know with 40 to 70% of us eventually getting it over the course of a year, that we have to have backups, and we're being very strategic about who's staying at home in case even myself were I to get sick, who will replace me during those 14 days where I'm staying home before I return. So this has to be part of our contingency planning. So that is news from the front lines. Next slide. So once again, we are knowing that most people will not be hospitalized, but in Ohio, we're seeing a lot hospitalized still, and we're starting to be able to look at who's actually going from hospitalized to the ICU. Next slide. So this is new, and I'm telling you, this is something I want everyone at home to pay attention to, because this is the effect of what you're doing. This is our first look at Ohio's curves, similar to the curves I've always been showing you. And it's very important to say that everything you have been doing, this would have been us by our projections. And again, this is beginning data. The more testing, the better these models get. But from what we can tell, and we have some great modelers coming out of the Cleveland Clinic and OSU and all our faculty working with my team, this would have been the peak of our surge had we not taken the decisive and important actions. I can't tell you enough, this is so important. We have got to even clamp down more. We have got to stay at home, and we can't go the other direction right now, because you can actually see a shift. But what we're seeing, and you can see how it's a shaded, ranged area. This will be on our website. This is our curve in Ohio based on the mitigation that we have done. And you can see it's a range, so the better we do, the more we push it out, the more we lower that curve. Remember that we have a hospital capacity line somewhere in here. We have, through our collective work together in Ohio, decreased that impact on our healthcare system by anywhere from 50 to 75%. That's crucial, but we've got to do it even more, because we are buying time, as the governor said. The further we spread out that spread of infection, the more time our hospitals are getting ready and doubling their capacity. But also, you know, I need you to know that it's not if but when. We will surge. At our peak surge, we may be as high as 6,000 to 8,000 new cases a day. So we're trying to keep that number. We're fending that off as long as possible. Our hospitals are gearing up more capacity, and we're also lowering that curve, and less people are getting infected. So that is going to make all the difference in our ability to handle this. We will exceed our capacity, but we've really been minimizing that amount. So Ohio, what you're doing absolutely is saving lives. With this, we see our peak is moving out toward, that surge is moving out toward the end of April. We'd like to get it even further out toward the beginning of May, because it will keep shrinking each time we do that. I want to add that Dr. Fauci shared some preliminary research. I was reminded of it when the governor shared the old St. Louis and Philadelphia curve. We know that they're going to be kind of different high points. It's not going to be a smooth curve. We don't yet know the effect of seasonality on it. We do not think it will go away completely, but anytime we let up on these measures right now, we can actually see surges again. So it's very, very important we follow those directions. Next slide. I want to talk a little bit about our need for PPE. This is also so crucial, and the moves you're making now by staying at home are actually helping us maximize the protective gear our frontline workers have. Right now out in the field, this slide shows what a typical month usage is by our hospital system and our nursing homes. And we know already mitigated versus unmitigated. If we had done nothing, we would already be way exceeding, but because we're doing things, we're staying real close to what we have. But we know still that we're going to need extra, both of gloves, gowns, and surgical masks, but the moves you're making are making our supplies go longer. The big one we're looking at are those N95 respirators. Those are the specialized masks for hospital personnel, not the surgical ones or the ones we might even make at home to not spread infection. But it is those specialized masks. We know even with the efforts we're making, we're going to need millions more. But we would have needed 65 times as many as our typical usage. We've lowered that down to 40 times as much. So again, everything we're doing is making all our gear last longer. Next slide. Our hospital capacity, we've been told, is at about 60% with our heavy flu season. But I want to talk a little bit more about the specialized parts of hospitals. This slide will show you what we have available is in the light blue, what we're utilizing right now in our hospitals based on OHA, Hospital Association data. These are negative airflow rooms that allow us to keep that infection from spreading in the hospital. ECMO, which is a basic type of oxygenation for very, very sick, our sickest people, ECMO it's called. We're only using about 13% of that right now. We have more capacity in light blue, but what our numbers are showing is that we know that we are going to either almost double what we need above this. So we're going to have room to use right now, but as that surge comes, we're actually building out more capacity because we know we're going to go up above what our hospitals normally have as their capacity. This is ICU beds, our medical surgical beds, and our ventilators. So we have capacity, we need more. We're doing unique things about repurposing anesthesia machines, repurposing something called CPAP, positive airway pressure machines. We're doing new tubing where more than one person can be on a ventilator at one time. We are inventing things. We are building out hospitals and existing building structures, but we know we will need more. Next slide. So that is sort of a summary of some of the data. We're going to have more for you every day. As the governor said, we're working closely with our hospitals in a regional model to build out our capacity. We'll have more on that for you. One thing I'd like to touch on, a hospitalized patient is in a hospital with coronavirus, with COVID-19, for up to 20 days. Remember I told you about by the time you're diagnosed, remember from when you're first infected, it might be 5 to 14 days before you show symptoms. It's another 9 to 12 days between someone who's actually has a disease might need hospitalized. It's another week or more before they might end up in an ICU, and our fatalities, our deaths follow those ICUs by up to 4 weeks. So everything we're seeing is lagging. And it's a lot like restaurants. They try to guess how many tables they'll need for a night, and whether we realize it or not, they're trying to flip those tables every hour to hour and a half. And that's how they staff, and that's how they know how many tables they'll be able to fill. And that's, what we're looking at is more like a long 4-course meal. Even though our hospitals have capacity that they usually gear up for, they're often looking at staying times of 3 days. But we know that we're going to hit peak capacity that we've never seen before in this country, and that folks are staying longer. And so that's why we know we really need to increase our capacity in our hospitals. Everything you're doing matters. It's life and death. And folks, please pay attention. You see what's happening in New York. You see what's happening in places like Louisiana. This is real, and everything each of us is doing matters. Last night I had a phone call with my husband. My husband, Eric, has been a school teacher for 35 years, most of it an elementary first grade teacher. He's also a coach. He works a lot with people driving the school buses, and we got a call from a close colleague, and Jennifer, I'm thinking of you. She, here in Franklin County, lost her father yesterday, and she called to ask again about funerals and what her and her family could do. These are very, very tough times, and we talk through, you definitely need to know that how we mourn and how we celebrate things like weddings is going to be different. You don't want these events to be the thing that got other people in your family sick or have somebody die. And we talk through how a small amount of our family that's healthy could talk and be together that night, but how folks are postponing things, doing celebrations of life later because they just don't want to put others in their family at risk. And these are very, very sad and very hard things we're going through together, but we are together. Stay home, Ohio, stay strong, stay together, stay at home, reach out to each other. Thank you.
John?
Thank you, Amy. Thank you, Governor. One of the things that we try to do here every day is respond to the questions that you have. I can tell you that the three of us and our entire team feel so responsible to you that when we're going through this difficult time, that we want to make sure that everything that we can do on our end to ease the burden in your lives is a top priority for us. Every day I work with our folks at the Unemployment Compensation System at ODJFS, Director Kim Hall and her team, who are working diligently to try to respond to your needs. You know that today it was released, the unemployment claims nationwide. Give you a little window into what we're talking about here in Ohio and what it means to our system. The week ending March the 21st, we had 187,780 claims. To put this in perspective, in all of 2019, we had 369,594. So as you can see, the burden on the system, the number of people that filed is an amazing number. If you look at that period in February, we had 112,000 calls to the call center. In the period that I just described through March 21, we had 1.7 million calls to our call center. And as far as the website, they're adding servers and building capacity to make sure that we are serving you. We know that not everybody is getting served at the pace that the demand requires. But you should know that they are working through that and that the team is trying to build that capacity. An important thing to know, that if you do not get through and you're worried about the timing of your benefits and not getting paid the full amount that you qualify for, they will make that retroactive. So just because you don't get through today or if there was a delay, know that they will make the benefit retroactive to the time that you qualified for it. So we wanted to ease your minds at least to know that while you may not be able to get through this, through the system in the time frame that you're trying to do, that your benefits will not be affected by it. It's like a rush hour on the highway. The highway system is built for a certain capacity, and when we exceed that capacity, the system can't handle it. It's happening at two ends. It's happening at the state end where the data is being received, but it's also happening sometimes in your home, in your neighborhood. That maybe in your own home, you might have normally nobody on the internet during the day, and you have 4 people on there, and that's happening in all the homes in your neighborhood. And certain places in the state, the capacity is just not there, and that can create a frustration. But I want you to know that we're working with the internet service providers, and we're working with our team to try to expand that funnel as best as we can. But be reassured that your benefits will be put in place retroactively. We also know that there have been a lot of questions about people who are self-employed, contract workers, 1099 employees. The bill that's moving through the federal government right now, through the Congress, would qualify those individuals for benefits. Their team is already preparing for guidance from the Department of Labor to administer those resources as soon as they become available to us. Just a couple of really important points there that I wanted to emphasize. A daily question, daily issue that I've been trying to address. The governor and I get lots of calls about this. We talk with our local government officials, our health departments, the state health department, which is of course led by Dr. Acton, about the stay-at-home order and the essential business list. It's important that you read the order and the plain language that's in that order at coronavirus.ohio.gov, and it's under the tab, Director's Stay-at-Home Order. Use your good judgment in following that order. Please know businesses do not need a letter or certification or anything like that to operate, but we do encourage that you prepare a document that serves as a rationale should a health official or someone in law enforcement show up and ask you to provide a validation for your operations. The mayors and the health departments have asked us to help you understand one thing. Do not call them for an interpretation of the rule. The time to call your local health department is when you see a violation of the rule and you're seeking enforcement. That's the time to call them. And definitely, as the mayor's requested of us today, don't call 911. This is not the place that you would refer these kinds of issues. Remember, if you're a business and you're a violator, you will get reported, either by an employee, a neighbor, a competitor. Somebody will call you out on this. So just follow the rules. We're asking it, particularly item 18 in the rules, which essentially requires you to create a safe workplace. The checklist is all there. Please follow that. And I will remind you of this, that even when we start to come out of this, we're going to need to continue those safe workplace regulations. So even if you're not a business in operation right now, you should go look at that list, because you're going to need to do those things to keep your workplace safe so that we don't have a reoccurrence of the spread when we start to come out of this. And as is always said, we are in this together, and the virus only spreads when we spread it. So that's why these orders exist, and that's what you can help us accomplish. Additionally, I just got off the phone before we came in here with Secretary of State Frank LaRose. The bill that will be signed tomorrow by Governor DeWine will establish a April 28th vote by mail date. It's important for you to know that you can already begin the process of requesting that absentee ballot. Go to voteohio.gov and you can print off that request. Also, you can find more information at that website on the entire election process. If you do not have the ability to print or acquire an absentee ballot request, you can call your local Board of Elections and request one, and they will send you one in the mail. So Frank LaRose, our Secretary of State, wanted me to remind you of all of that, because we want everybody who wants to cast a ballot to have the opportunity to do that. Your local boards and Secretary of State's office are trying to account for that as quickly as they can. I was also contacted several times, and Governor and I hear this. We hear the mix, and this is we're trying to get the balance right on this. And we talked about the need for businesses to operate with the proper health requirements, and urging everybody, again, if you can work from home, if you cannot come in contact with anybody, then that's the way you should operate, even if you're an essential business. But there are some people who are out there in the workplace that can't do that, and they are real heroes. The people who stock your grocery stores and are part of that food supply chain, they have to show up, and we're grateful for them showing up. We're grateful for the delivery personnel that are delivering things to our homes during this time. Remember, there are all people with families out there who are putting themselves in a position where they're trying to do their duty to all of us as citizens and provide those essential services. You know, I think about the tech companies and the telecom. I mean, all of those folks, we're all on the internet and we're getting this stuff digitally. That takes a backbone. We have utility and other personnel that are out there doing these things during this difficult time, and we're grateful for their service. And certainly, last but certainly not least, first responders, nurses, doctors. I hear from a lot of them, and one doctor that I interacted with asked me if I would share this message. He said that it's very scary for the people who are working in our hospital systems, that there is a disease, a virus which is very deadly. And these nurses and hospital workers and doctors are putting their lives and their families' lives at risk by merely doing their jobs. And they said, you know, every one of them, we're willing to do this. We're willing to put ourselves in this position to try to help Ohioans live, thrive, and stay healthy. But they all have one thing that they're asking of all of us. Just stay home if you can. Practice social distancing. Don't create the spread that's going to put these workers in jeopardy any longer than we need to. We will get through this, but we'll get through it faster and healthier if we all cooperate and act responsibly. So thanks for all of those workers that are out there doing those wonderful things. They're the backbone of our economy. They're the backbone of our healthcare system, and we're grateful. Governor?
Thanks. We're ready for questions.
Governor, thank you very much. After seeing that incredible increase in the number of first-time jobless claims today, is it your expectation this is going to continue for weeks, maybe not months, but weeks? Does the state of Ohio have the money to be able to keep people afloat, all these families who are depending on the system here? Will you need to dip into the rainy day fund or make some other move? What do you think?
Well, we've known for some time that we have to have a long-term fix. And that's something that we will have to do with the state legislature. But people should not worry. The money will be there, and they should continue to apply. That's what we want them to do.
Thank you very much.
Hi, Governor. This is Molly Martinez with Spectrum News. This is a question for Dr. Amy Acton. Can you please reiterate what you said yesterday about homemade PPE and whether or not it's safe for those on the front lines?
So homemade is not what our frontline first responders are using. They're using those N95s and the things that can keep the virus from entering. But the homemade is very good for the same way you see us sometimes put a mask on the sick person. And that's a surgical mask. That's the different. I wish I had my examples with me today. When there's nothing else available, something like that can be useful for me, the sick person, not spreading something to you. So you always hear about anyone who comes to the hospital right now when they're sick, we put a mask on them. And there is going to be a limited amount of those. So, we're hoping to use mostly the supplies we have, but we realize that in a very likely chance that we might be using things that we've never used before. And that's why even the CDC, even for healthcare workers in a worst case scenario, has examples of what you can make yourself or using bandanas. But we hope to not get there by saving and conserving our hospital equipment for our hospital workers and our frontline providers.
But theoretically, if somebody were to come in sick and you would put a mask on them, would that protect the healthcare workers?
Theoretically, it does help them spread it, but the healthcare worker, if it is a known case of COVID, needs to be in full PPE gear. And so what our hospitals are doing is, sparingly using that and having one worker work potentially with a bunch of people. And little tricks, like I said before, about taking the IV fluids outside the door so someone can come by and adjust the machines without being exposed to the patient. That's why we stopped the elective surgeries, because we really need all that equipment that was out there to be used in this emergency.
And then the second part, could you please give us an update on what the state is doing to assist the ongoing breakout in Miami County in the assisted living facility?
Yeah, I'll have my team give you more details, because a lot of that is happening at the local level, as you know. But we have created a whole set of guidance that is helping. My fellow director, Dr. Maureen Corcoran, has been spearheading that alongside our epidemiologists, helping the nursing homes work through how to best handle that outbreak. That's our we know we're most vulnerable in nursing homes, long-term care, and it's a very difficult situation. And I just, again, want to say to the employees that are working so hard to keep the residents safe, you are definitely our heroes.
Thank you so much.
Thank you.
Kevin Landers, WBNS 10 TV. My question is for Governor Mike DeWine.
Kevin?
Hello, Governor. My question is, there are thousands of Ohioans right now who have school-aged children who are looking down the road about what the school year may or may not look like. Can you kind of walk us through where you are in your head about whether or not there will be school this year? And also, with the nice weather that we're having, we're seeing lots of congregations of young kids playing basketball on basketball courts, people golfing. What's your message to those people as it pertains to the stay-at-home order? Thank you.
Well, in regard to people playing basketball, obviously a great sport, but in our call today with two mayors, with the number of mayors, at least two of them said they had taken down the basketball hoops in their city at the public playgrounds because people were just gathering. It's kind of hard not to be together when you're playing basketball. So again, distance is the key. Whatever people do, keep a distance. And that's what is significant. And it's very tempting as the weather gets nice. And I know that, again, several of the mayors told me that they were having some challenges in regard to parks, that people were coming together. And again, go out, enjoy the outdoors. I plan on taking a walk tonight. Took a walk last night with Fran, but we got to keep the distance. Don't bunch up too close. As far as the schools, we don't know. We clearly, if Dr. Acton's projection that we peak in latter part of April, early May, obviously you're not going to have school open before then. And it's going to take some time after that before you have school open. So is it possible that we do not go back into school this academic year? Absolutely. But I don't think we're at the point where we can make that determination. The legislature, as you know, has already taken care of the mandated tests. That's been taken care of. Our teachers and our administrators, parents are doing heroic work. They're doing some amazing work in regard to distance learning. The real challenge comes in those schools where they don't have the internet in homes, or they don't have the internet service, and it's much more difficult to do that distance learning. And that's a big challenge.
Thank you.
This question is for Dr. Atkin from Jim Province with the Blade. You talked briefly about the Toledo-Lucas County Health Department and the situation there and the fact that you're working on contingencies. What is it that can be done when the department on the front line is closed down and the director is self-quarantined?
So it's going to happen. 40 to 70% of us will get this virus, as it's projected now by the current science, over the course of this year. And we will get sick, we will mostly stay at home, and we'll come back. So they have lots of plans in place for that. I spoke with the health commissioner this afternoon, and I also talked to him about his plan. And fortunately, a lot of folks were already working from home, so they're not sick right now with it, but they were exposed to someone who was diagnosed, so they're self-quarantining for 14 days. So they're doing their epidemiology and their investigations, which are done by phone typically anyways. They're doing those from home. So we have a lot of, even in my staff, I have 1,100 people that work for me, and most of them are now working from home. So they're continuing that work when they're feeling well. Some will not be well. We have a whole contingency workforce plan for public health. We actually are bringing back folks that are retired epidemiologists, and we're working with our universities who have these same talents. We're also in the beginning of making a new amateur epidemiologist workforce of med students and nurses who we intend to use when we finally have the extensive testing to blanket Ohio. So we're building up more workforce. The folks that can work from home are working from home. I know the health commissioner talked that the WIC clinic has gone to curbside food. That's the one remaining service that's so essential. I think the health department itself is closed for 2 days, undergoing a very thorough cleansing, but it will reopen and reinforcements will come that need to be there. The rest will work from home, and that WIC clinic will resume curbside.
Have you seen a similar situation anywhere else in the state?
That is the first I've heard of that, and I was on a health commissioner and health department call. We do calls routinely every Tuesday and Thursday, and I reiterated again to my colleagues, let's make sure, myself included, we all have those contingency plans in place. It's very important because we're frontline, and we're going to keep going all through this.
Thank you.
Thank you.
Hi, Tom Bosco with ABC6 here in Columbus. A question for Lieutenant Governor Husted. Lieutenant Governor, we're glad that you addressed the situation with the unemployment website and phone calls, because as I mentioned yesterday, we continue to get a lot of calls. Do you have any idea when you think the system will be up to speed or able to handle the surge in calls and online hits? And what is it going to take? Is it just more hardware? Is it more manpower?
Well, it's a great question. I appreciate you asking, because there's one other thing, a piece of advice I can provide. The online version is online 24 hours a day. So as I mentioned, I talked about that highway traffic where you have peak times. There's two phases where peak times happen, is at both ends, where the internet service provider at your end of this, where you might be in a place where there's heavy use, and so it's not getting out, or you get kicked off from your end of this, and then it's flowing through the system and coming to our end. If the more we can spread that out during the course of the day, the better off that the system won't get overwhelmed. And they're adding the capacity, they're adding servers and capacity, but not all of it is a problem that we can solve because of the nature of how the flow of the information occurs over the entire system. And so the parts that we can solve, we're trying to add servers to expand the capacity. I think the capacity that we're trying to expand, that we're hoping to get to, is about 15 times what it normally would be. That's what they're working toward. But so my one piece of advice is that know that the online piece is available 24 hours a day, and so you might want to try in an off-peak time to improve your ability to get through in an efficient manner, and for the system to handle that. But we're building what we can on our end, but all of these problems are not, from a tech point of view, are not solvable through the state system.
Any thoughts given to expanding the hours people can phone in, or having more humans available more hours of the day?
Yeah, we're working on having the personnel, because you actually have to have trained personnel to be able to do that. I know that Director Hall is working on building that capacity. I have calls with her every day. I want to thank her and her team. There are hundreds of them there who are also making sure that they're coming to work every day as essential servants to do this. I do want to thank them. They're probably tired of me right now, as hard as I have pushed them to solve this, and so I appreciate what they're doing. Director Hall is trying to train people up and get them in there as quickly as they can.
Thanks.
So this is Danny Eldridge with Hannah News Service. My first question is for Dr. Amy Acton. Just to clarify on the ICU admissions, is that a cumulative total, or is that the number in ICUs today? And how is that going to be updated going forward? And also, I'm sorry, go ahead.
Oh, go ahead. I was going to say, it's a percentage of the total, I believe.
It's a percentage?
Yeah, it's how many of our total cases are were ICU as part of that case.
Okay, and then on building out hospital capacity, does that also apply to ICUs? Are they going to also have the same amount of build out, or?
Yeah. So everything's about the ICU, and that's what I live, dream, sleep about right now, is how we build that. It's one thing to be admitted to the hospital, and what I think you'll see is, as we make this regional model and we build out something that we've never really had to have in this country before, you're going to see solutions like one hospital taking all the more low-risk kind of normal things, maybe like a delivery, and saving in some places, like I was talking in Southeast Ohio today in the Appalachian region, to having a whole hospital become sort of a COVID hospital, so that you can cluster your use of your the equipment that you need for the sickest of the sick, the life and death stuff. So ICUs, we need more of that. We need more things that have the ability to have a ventilator. You'll see us using ERs as ICUs. You'll see us using surgery suites and even emergency rooms. So a lot of it is turning it into the capacity for the sickest. And so ICU is everything, and increasing that capacity is what everyone is focused on right now.
So I also want to know, what should abortion clinics be doing to comply with your order right now?
Right, so right now we have listened to the AG, who has asked for all, remember that everything we have done about non-elective surgeries has been about conserving PPE. We have some violations across the state. the AG has asked for those to be investigated in our usual survey process, and those are ongoing.
So what would constitute a violation?
What's the question?
What would an abortion clinic have to do to violate the order?
The order, again, this is being investigated by the health department. As Dr. Acton said, the reason for the initial order was that we need to preserve the personal protection equipment and other things. So it applies to abortion clinics as it applies to other clinics, where allegations have been made that I think one urologist was violating it. There's an investigation ongoing there. There's an investigation ongoing with abortion clinics. So the order is clear that elective surgery is not permitted. Now, if you're dealing with something that has to take place, life of the mother involved, obviously, then that could take place. But it's consistent through abortion clinics and any other clinic, any other hospital in the state. It's a consistent order. What they're now doing is going out and investigating and find out what the facts. Facts are always what drive every investigation.
All right, thank you.
Adrienne Robbins, NBC4, and my questions are for Dr. Acton. You said when the surge comes, we could see up to 6,000 to 8,000 new cases a day. That seems like a far cry from the a little over 150 new cases we're seeing now. Because of the lack of testing, could we be much closer to that surge than we even know?
Absolutely, and we will never be able to document all those cases. Of course, we'll see that percentage that enter our hospitals. But a lot of these cases, just like they have been in New York, even and in other countries, will be presumptive. By the case history, what you'll see is people exhibiting the symptoms in dire need of that intensive care treatment. So we will not have the testing that will be able to test even every sick case. We will presume it as such.
And then you brought up that there are quite a few medical advancements being made, 2 people to a ventilator. Do you foresee that this pandemic will ultimately lead to quite a few medical advancements just out of necessity?
Absolutely. I think so many facets of our society are going to transform through this. And you know, yesterday we were asked a lot about the public health system in Ohio and how we really need to invest in that. But it really is the public health and the healthcare system working together, and we are working together right now in unprecedented ways. And I think, you know, you'll see that grow and develop as it should to provide, you know, the very best to promote the health and well-being of all Ohioans. So I suspect from technical innovations to actually how we all communicate and share data. We're sharing data in ways we've never shared. Hospitals with us with hospitals. There's no lag time, there's no bureaucracy. We are just all rowing in the same direction. And I think those things will all lead to sort of something better for people in the long run. Thank you.
Thank you.
Good afternoon, Randy Ludlow with the Columbus Dispatch. A question for Dr. Acton. Director, President Donald Trump has proposed today to rate the nation's counties by degree of virus risk, high, medium, low, to potentially allow health restrictions to be removed from counties with low incident of coronavirus. Is that sound public health policy?
I think one of the things we're going to have to look at is what testing is available. It's very, very hard, as I said all along, to draw any conclusions about our state when we were one of the last states to actually receive the working test kits. And rightfully so, there's prioritization going on of scarce resources, but we can't assume anything about what's happening in any given community because we really can't test for it. So I think it's really important, and that's why you see states and localities making the decisions they have to make based on what we're actually seeing on the ground in our hospitals, what our clinicians are telling us. And I can tell you, I feel that, again, to those of you at home, you are saving lives. We have already saved lives by what we're doing. We really, really, really have to follow the sound public health advice. Believe me, we will lift it the second we can in the most responsible way we can. And there will be a whole art to that that will be based in science. But right now, it's unequivocal what we need to do. We need to stay home. Thank you.
So you would not be comfortable removing a stay-at-home order on any county in Ohio at this point?
At this point, we know that all Ohioans, you already see documented spread in at least 60 of our counties. And we know there's more. As I've said, not everyone has been tested. Most people with this disease right now will not even get tested. They will stay at home and weather that out. And in every county, people are ill and staying at home. As the Lieutenant Governor said, you know, his colleague is working in a hospital right here in Franklin County. Their floor is full of sick people. Not all of those might even get tested now. We can assume, even within some of our nursing homes, we see the symptoms, we know they have it, even without having to test for it. So we will be following our amazing governor's guidance on how we weather this storm together.
One quick clarification. You referred to 6,000, 8,000 cases.
At peak.
In what context, when? Is that you perceive as the maximum?
Yeah, our modelers, based on the best data we have available in Ohio, and again, that data will get better and better and refined. And that's why you'll see when you go and look online at our graph, it's sort of shadowy because it's from like our least amount to most. That will be at the peak surge that we could be seeing that many cases a day.
You're referring 6,000, 8,000 cases at the same time? Is that what you're saying? A day?
A day.
New cases a day?
Yes, remember, this is doubling. In New York right now, it's doubling every 3 days.
And do you agree that's around the May 1st time frame?
That's our best projection, and it's really holding true. That was some of the national modeling that had been done in the UK modeling, and it's looking, from our preliminary look, our first look into Ohio's data, that we had at least enough to do that general forecasting. It's looking like that. But everything we do, I know this sounds terrible, but the more we can push that surge off, the better our hospitals are getting ready. They're getting ready and building out their system, so every day matters.
Thank you.
Thank you.
Good afternoon, Laura Bischoff, Dayton Daily News. Dr. Acton, can you give us an update on the development of blood tests to determine which healthcare workers may have already had COVID-19 and they could presumably return to the workforce with immunity? And also, are there plans being made for like a second wave of healthcare workers kind of waiting in the wings? Because you've talked a lot about equipment, but certainly
it's people.
The supply of these workers is important as well.
That's right, Laura. So, you know, we do know that there will be potentially waves of this and surges of this disease. And then the workers, the healthcare workers, we're looking at all sorts of things from retired to repurposing. You might have seen there's a great story in California where surgeons are being trained as nurses. We're doing a lot of this look at just-in-time training. It's funny, but when I trained in medical school, I really wasn't taught a lot of pharmacy or, you know, how to give shots or do blood. But when I went to New York City, where I started my residency at Albert Einstein, I was actually trained to do all of that. There are a lot of docs out there who can't do some of those real basic things, but they have volunteered, they want redeployed because they're not doing those elective surgeries and they want to become frontline healthcare workers. So we're looking at that. We have a medical corps in Ohio. We're looking at some folks who are more aged, not being on the front lines because they're more at risk, but being on those phones, doing the telemedicine. And of course, we're looking at a new group of people from students who are about to graduate who can be trained. So we're looking at all workforce options.
How about blood tests?
Blood tests, thank you. So your first question was about blood tests, and there are blood tests in existence that I've heard about around the world, nothing that I've seen yet in this country. I know folks are working on it. It's called serologic testing, and that will be vitally important Antibodies develop, particularly the IgG antibody will develop in response to the acute infection. And when we're able to actually do a blood test, not only does that need a lot less equipment, nasal swabs, kits and stuff, but it's quicker. And we'll be able to look back into history and see that somebody might have had it that was never diagnosed with a test, but we can see that their body actually fought off the disease. So there are fascinating things being done. And any of these medical interventions, if we're so lucky that one of them comes available and works, when that testing comes available, we'll leap forward in what we can do and how we can get out of this. But also, it will teach us so much about what has happened here. So any of that might even change the curve. If we find an antiviral that actually is effective and proven effective, we know vaccine is far off. That's the gold standard. That's what's really gonna kind of get us out of the woods as a country, is when we have a vaccine. But there might be some things that happen that we can't even predict yet that could have an effect on this. So a lot of folks are hard at work at innovation.
Okay, thank you.
Thank you.
This is Jackie Borchert from the Cincinnati Enquirer. Dr. Acton, I'd like to go back to the curve. I don't know if you can show it again.
Can we go back to the very colorful graph? Eric's going to see if we can do that.
Red and blue, two of my favorite colors.
I know. Yeah. My team picks those colors for me based on that, so I appreciate that. If we're not able to pull it up,
sure,
it'll be on our website.
I just wanted to clarify. So the red kind of sharp peak it looked like about 40,000 cases at what would be today, and that would be if we had not taken any mitigation.
That's right.
And then the dark blue, smaller slopey line, that's what we are on, given all the measures we have taken in the last 3 weeks. Is that correct? Or are there other factors?
That's right. And remember, going back in history, we actually did mitigation and we did containment. So in the earliest phase, while we only had the ability to test 8 people through the CDC process, because there was a turnaround time and a very strict case definition early on in this, we had a lot of travelers coming back. So one of the things I'm most proud of our local and state epidemiologists doing is we decided to take a very strict approach to people returning from travel. We didn't do an order, but we asked everyone to self-quarantine for 14 days, even though they were asymptomatic, when they were returning from some of those high-risk areas, especially through those 11 airports. And they all complied, and we did very extensive contact tracing on folks early on. That is also part of that containment. And so all of those things were in play that helped move that curve. And then, but what we're doing right now is really, it's so essential to why we're being able to buy more time, as the governor said.
So that blue line, that is our trajectory projected now, given all the measures that we have now staying in place, or are there additional?
Staying in place and getting even better. I've always said that we do have to have people out and about, so we can't lock down any more than they could originally lock down the borders of our country as an impenetrable, perfect hermetic seal. But we want most of us, the more of us that are not infecting other people. I infect up to 3 other people. Those 3 people now logarithmically impact 9. All of us that stay out of that pool of spreading logarithmically change our trajectory. So we can be even more strict than we're being now. We shouldn't be playing basketball on the court. Golf, somebody asked for, if you're far apart and you're out in nature golfing, and clean off your clubs, that might work. But anything that's putting us, mixing it up with other people, we should be down to our smallest groups by now. 10 at the max. We've seen recommendations of 2 to 3 in Germany and places like that. We really should be staying with a very small group of folks right now.
And just one more quick follow-up. So this is from the Ohio State University's Infectious Diseases Institute. How does this model compare to some of the other ones we've seen, like the Imperial College last week? I think University of Washington had one come out today.
Yes, it really is following that classic epi curve that we've talked about using those non-pharmacologic interventions, the Swiss cheese of the 4 layers of things we've put in place. When we do them all together, it can be up to 80% effective. And we're looking at, a change in some of those numbers. That was in the Cleveland Clinic model we looked at least having a 50% impact. And OSU is as promising as 75% impact. So, we are still going to have a surge. I told you there was no surge option. We were already too far along down that curve of the spread of this very infectious, much more deadly disease than the flu. But these mitigation things are decreasing and increasing our chances and saving lives. Thank you.
Hi, Governor. Andy Chow with Ohio Public Radio and Television's State House News Bureau. I'm wondering if we could talk a little bit more about evictions and foreclosures. I think that the news of delaying these proceedings will be received well by a lot of people, but what do you say to those who see that as only sort of delaying the inevitable? If they're not getting a source of income right now, delaying it a month or two to only be evicted a day or a month or two, what do you say to those people? Are there other sort of maybe safety net things out there for them?
Well, the package that was just passed by the United States Congress process certainly provides a significant amount of money. It's not clear. I haven't gone through the whole summary of the bill, but it's, there certainly is money going to come out to individuals. Look, the problem with totally forgiving that, unless there was some money that then transferred to somebody who owns an apartment building, for example, they may not be able to pay their mortgage either. So you can't just say that's all going to be forgiven unless there's some money, some way to compensate the person who might have a mortgage on that building. So, there is money coming to individuals. There's other things that will help individuals. So, we hope that will work. But this whole thing is a work in progress as we look at how to help people. And as this money comes back from the federal government. So these are difficult and tough times. I think what the legislature did and the Chief Justice's order that she is going to put out does give courts the flexibility to weigh the particular circumstances and to hold things up. If here you have someone who's unemployed, someone who's lost their business, give them a break on time and kind of hold that case in abeyance if there's actually a eviction that is filed. It also gives them the opportunity, though, if somebody is in fact should be out of a home because they're a threat, a domestic violence threat, or they're there for some other reason, they've violated the law, they've are selling drugs or something out of there. We need to have the courts to have that flexibility. So I think this is a logical step forward by the state legislature.
Thank you.
And just Andy, again, on a personal note, since you keep putting things up on Facebook that my wife looks at, I'm glad to see that you're doing your exercising at home. I thought that was quite. Anyone wants to see Andy jumping?
I'm getting kind of bored. But
were you a long jumper, or is that?
No. That's just me getting bored and just trying things at home. So.
Yeah, I don't know. You look like you're flying from one side of the room to the other. It looked pretty good to me. So.
He got the cake. He done the cake. Yeah.
Thank you, everybody.
It was interesting.
This is Laura Hancock with Cleveland.com. Governor DeWine, as you know, the president sent a letter today saying that with the administration is working to publish new guidelines for state and local policymakers, and they'll be guidelines to tell you guys to maintain, increase, or relax social distancing and other mitigation measures. Do you plan to go by these guidelines, or
So I missed the last part. I apologize, but it was to do what? I'm sorry.
They're going to publish new guidelines to help for local and state policymakers to use in making decisions about maintaining, increasing, relaxing social distancing and other mitigation measures that you guys have put in. Will you stick with your team of healthcare advisors, or do you think you'll go with these ones?
Well, I haven't seen the letter yet, and so I'm not sure, you're quoting the letter, but I'm not sure exactly what they're proposing. But certainly at some point we want to relax this, but we're not to the point now when we can do that. In fact, we're telling people that this is really a crucial time, very critical time, and we want people to be very, 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 very careful. I mean, what occurs now is going to determine whether we literally have the capacity in our hospitals. Even if we build them out double what we have, what we do now is still going to determine whether we overrun these hospitals and get to a situation where our medical folks are making life and death decisions. And, we do not want to be in that position. So I worry about this every day, and all our team does. So stay home.
Okay, thanks. And then we've heard over the last several days with this, at this briefing, read the order, police can't interpret it, local health departments can't interpret it, but at some point there may be expensive litigation with abortion clinics or with private companies over these, so the Attorney General may have to interpret the orders when he's doing briefing prior to trial. So why not set up a hotline, or why not do a Q&A document? Like, why are employers and I think employees have a lot of questions?
Okay, now maybe I misunderstood you. I heard a couple of different things. Were you talking about the orders that businesses have in regard to social distancing and all the things, and whether they're complying with that? Was that part of? Yeah,
I mean,
we did something I don't know other states did. They may have, but what we put in the order about closure, we also put a list of things that are pretty plain, I think, pretty easy to understand in regard to what companies that are allowed to stay open have to do. And so as we have people go out from our local health departments, let's say they get a complaint, they go to this business, it's not very difficult, if you look at that list, to say, are they keeping people 6 foot apart? Are they doing the sanitation things that they should be doing? So we think that's pretty plain. We think that certainly can be interpreted by the business easily. We think it certainly can be interpreted by anyone who goes out to inspect. So we don't think that is a difficult thing at all. Now, you're talking about abortion clinics, different issue. That particular issue has to do with the ban on elective surgery, things that could occur or may not occur. And once again, if you're dealing with this procedure, whatever it is done to save someone's life, well, obviously that's something that needs to be done. But if it's elective, then the order says they can't do it. And the reason is we didn't just make this order up. It was put into place at the request of people in the medical community who wanted us to do this because we need to be able to preserve the personal protection gear and all the other things, the mask and everything else.
We're hearing from a lot of workers that their employers don't even have soap. And one woman told me that when she tried to report her employer, whoever she reported it to, they outed the, they let the employer know she was the one who told.
Well, look, we have a big state. We have 113 health departments. They're very, very busy, but they are in the enforcement. People can make complaints. They can go out and they can determine whether or not they're following the orders and following the rules. I mean, basic things like having soap. I think I heard you say that's kind of basic stuff. And I'm not judging that particular case, but if the facts show there's no soap, and this is kind of a no-brainer case.
Thank you.
Thank you.
Governor, if I could,
John?
add, Laura, to help you clarify the difficulty in some of this. First of all, let me say, I believe most employers are complying with this, and I believe most of their employees are to be congratulated for the way that they're implementing it. But like all laws, there are going to be some people that don't do this right, please contact your local health department, detail what's going wrong, and ask them to come out and investigate it. And I know that we have 88 counties and some city health departments. They're differently staffed. As we heard in Lucas County, they're having some challenges there. So the implementation, the enforcement is going to be based on their ability to do it. But we're trying to give them that guidance through the way that we wrote the order. But let me just give you one example. Let's take tree trimming. Okay? I had this specific question. If it's ornamental tree trimming at a residential property, that's probably not something that's essential. But if they're trimming back a tree that's leaning and might fall on that house, or if it's utility lines that they're clearing the trees out from, because if we have a storm, they're going to come down and they're going to put people out of electricity. That's why that's an example of why this is complicated, and that we need businesses to use their honest, good judgment in following these rules to make sure that they are essential and that they are complying with the health requirements.
Thank you.
Thank you.
Governor, Luis Gill with Ohio Latino TV. And one of the questions I have, and oh, by the way, this is the last question. One of the questions I have that you monitor the virus and you have a curve that you'll be monitored. If this virus gets out of hand, or is there a trigger point that you might have that you calculate, or is there a plan where the order to stay home, you have to enforce a little stricter, or you have to place another order because now the virus is not, it's not being monitored with your curve that you, Dr. Acton, described?
I'll take that.
So thank you for the question. I think, we're really using the full force of mitigation now. I think there are a lot of recommendations yet to come. We saw travelers from New York. We saw Dr. Burke ask that if you were traveling outside of New York, that you automatically self-quarantine yourself no matter where you end up in this country. I think there'll be layers upon layers of subtleties, but there isn't anything that we have on the horizon right now. But this situation is so ever evolving. I think what we've always said all along, we've had that little commercial on being together with Jim Tressel and Cardale Jones, and I said early on, this is a lot like Audibles. You have a playbook, but we're reading the situation each and every hour, and we have to make some last minute changes, and we'll just keep reading the situation. We'll keep telling you about it,
yes,
and we'll bring you along with us.
Great. Thank you so much.
Thank you.
Thank you.
Well, in the spirit of opening day, we came across a cartoon which we'd like to show. Thought it was kind of cute. Happy opening day. Round third and stay at home. Mr. Redleg there. Ohioans are always been resilient. We've always been tough. We've always been resourceful. So I'd like to conclude with a kind of a personal story. 1939, my dad was 16 years old. The Reds were in the World Series the first time in his lifetime playing the Yankees. Yankees won the first two games at Yankee Stadium. Third game was going to be in Crosley Field. So my dad and his buddy got in a car, and in those days it was at least a 2-hour drive from Yellow Springs to down Route 42 down to the Crosley Field. Dad stood in line, as he remembered it, for 16 hours trying to get a ticket until he was there with his buddy. And he had a deal. You could buy 2 tickets. That was the max you could buy. And whichever one got to the front of the line first, it would buy the 2 tickets. Well, unknowns to them, when they opened the windows, they opened fewer than lines were. So people started converging in different lines, and he and his buddy got totally lost from each other. Dad got to the front of the line, bought his 2 tickets, but then he couldn't find his buddy, and looked all around. Finally, it was game time, and so Dad went in, went to Old Crosley Field, and somehow climbed up as high as he could go, so that he could literally look out and he looked out to see if he could find his buddy. And he saw him, and here was this, his dad recalled, a 16-year-old boy who was a pretty big kid who was literally walking away from Crosley Field, and he was very upset. He was crying. So Dad yelled at him and got his attention. And my grandfather had given my dad a silver dollar that my dad always carried. It had the date of his birth on there, which is 1923. And so somehow Dad wrapped this, took the ticket, kid's ticket, wrapped it somehow around that silver dollar, and literally threw it out to him. And his buddy got the ticket, went into the game, and they watched the game. Reds lost. Actually, the Reds lost the series 4-0, 4 straight games to the Yankees. But it's a story that I always remember on opening day and anytime I go to a ball game. But again, it's my dad was optimistic. My dad was a resilient person, as was my mother. And it's a story I just wanted to share with everybody, because we are Ohioans. We are resilient. We are tough. We are strong. And I want to end by showing another video, a separate video, kind of the same theme from what we showed yesterday. But these are Ohioans doing what they should do and working together, everyone staying together to get through this.
We've always been Ohio strong. And now, we need that strength more than ever. It's up to all of us to stay home, stay positive, and stay healthy. And even though right now we can't gather together, in Ohio, we will always stand together.
We are in this together. We'll see you all tomorrow at 2 o'clock. Thank you.
Wrapping up his daily coronavirus update, Andy Chow back here with me. One quick takeaway from this.
I thought it was interesting, the numbers that Dr. Amy Acton put out there. They have new graphs and charts sort of explaining what's going on and the modeling that they're doing to try to figure out what exactly is happening in the state when it comes to coronavirus, and trying to stay within the capacity for hospitals. So I think it's interesting that more modeling is being put out there to figure out exactly what's going on.
And she is saying that modeling is showing that these measures are working. Obviously, data is still coming in. So this is just at least what she says is the initial picture here. One thing that was announced today also, coronavirus.ohio.gov has a new dashboard that has an awful lot of information about the data that's coming in, showing county by county breakdown, and kind of giving you a sense of where things are happening. Final thought, Andy.
Unemployment compensation website still not working very well, so people are having a hard time getting their claims filed. I thought it was interesting that Lieutenant Governor John Husted said, listen, if you're not able to file your claim today or tomorrow, your benefits will still be redeemed retroactively, and I think that might come as some good news to people.
But again, they're working on that website, trying to get that up, saying that also that 1099 self-employed contractors are part of that federal bill that's passing, and so that there will be some relief potentially for those folks. Anything else? We'll be back here tomorrow at 2. You asked about evictions. There was a little bit of a hint here.
Yeah, I think that he's just putting the message out there that, look, courts are asked to delay these proceedings. Landlords, banks, they're asked to hold off on this. There's a stimulus package that's likely to come from Congress, from the federal level, to might help with all this. So I think he's trying to put the message out there that if people are afraid of evictions, that they should maybe try to work with their landlords to try to figure something out, because obviously right now with people losing their source of income, people shouldn't be evicted or foreclosed on right now. Also today, an announcement, an email address for people who want to participate, want to help out, together@governor.ohio.gov. There are lots of people who say that they're making masks and want to do some more, and that's a website that he said is kind of a clearinghouse for people who want some more information about where to give their stuff up if they're doing these sorts of things, what they can do then. So we are back here again tomorrow for another daily update on coronavirus in Ohio with Governor Mike
Mike DeWine and Dr. Amy Acton and Lieutenant Governor John Husted. As we go into the end of this press conference, rundown of the final numbers here. 15 deaths from COVID-19 now recorded in Ohio, and 867 confirmed coronavirus cases in at least 60 of 88 counties. That's about a 23% increase from yesterday. 223 hospitalizations, 91 of those are in intensive care. And the patient age range, less than a year old to 94 with a median age of 51. And also those people in intensive care ranging from about age 23 to 94. So that shows a little bit more the data and the breakdown that we have on the numbers on coronavirus. And this concludes our live coverage of Governor Mike DeWine's daily update on coronavirus in Ohio. For more information, tune to Ohio's public radio stations and television stations, and you can go to our website at statenews.org. My thanks to my colleague Andy Chow. I'm Karen Kassler. Thanks for tuning in. Have a good evening.